Welcome to our detailed exploration of acute pancreatitis. I am Paramita Chatterjee and today we'll uncover the critical aspects of painful and potentially dangerous condition which is called pancreatitis. Before the class, we already discussed about the definitions of pancreatitis and anatomy of pancreatitis, and after that we discuss about the etiology of pancreatitis and then sign and symptoms of pathophysiology of pancreatitis and then sign and symptoms of pancreatitis. Today we'll discuss about the complications of pancreatitis. Acute pancreatitis can lead to severe complications. Locally, patients may develop pancreatic pseudocyst where the fluid collects around the pancreas, pancreatic necrosis or tissue death or abscess formation, and systematically the inflammatory response may result in multi-organ failure or respiratory distress and renal failure. One is locally complications, which is pseudocyst or abscess formation, and systematically what happened? Multi-organ failure, respiratory distress and renal failure. First of all, we would like to discuss about the systemic complications. How multi-organ failure happened, how respiratory distress occurred and renal failure happened. First, we emphasize on the systemic complications. After that, we will discuss about the local complications. So previously we study about the pancreatic enzymes, protease, lipase, amylase secreted from the pancreas, and when it stay in the pancreas it is in inactive form, and when these pancreatic enzymes arrived at the duodenum it's become active form and it starts to help in digestion. But in abnormal condition or in case of pancreatitis, this protease, lipase and amylase start to digest, helps to digestion in pancreatic tissue. Okay, so auto digestion of the pancreatic cells, because due to in advance activations of pancreatic enzymes. Then what happened? Then it irritated the pancreas. When the pancreatic enzymes activated before it arrived at the duodenum, when it activated in the pancreas, normally it is in inactive form, but when in abnormal situation in pancreatitis, protease, lipase or amylase get activated in the pancreas, it irritates the pancreas and pancreas get super angry due to these activations of pancreatic enzymes. So pancreas get angry and pancreas get inflamed. Increased inflammation. When pancreas is inflamed, it really starts to stimulate our immune system. Our immune system get activated. When our immune system get activated, it stimulates activations of neutrophil and macrophage. Neutrophil and macrophage comes here when the pancreas is inflamed. It transferred the signal to our immune system and neutrophil and macrophage come here. And when neutrophil and macrophage when on action, it release cytokinin or they pump out cytokinin. Which cytokinin? Interleukin 1, interleukin 6 and TNF alpha. That much clear? When our pancreatic enzymes get activated in the pancreas in advanced situation or in advanced time, actually in normal phenomena, these pancreatic enzymes get activated in duodenum, not in pancreas. But in pancreatitis, these activated in the pancreas. When these enzymes activated in pancreas, pancreatic cells got irritated and it got super angry on the presence of protease, lipase or amylase activation. So it increased the inflammation. When pancreas got inflammation, our immune system send the message to our neutrophil and macrophage, and neutrophil and macrophage present here. When neutrophil and macrophage come here, it pump out cytokinin. Which cytokinin? Interleukin 1, interleukin 6 and TNF alpha. When cytokinins are released from macrophage, what happened? It get into the bloodstream. This is the blood vessels. Cytokinin get into the bloodstream. When the cytokinin get into the bloodstream, what happened? Systemic inflammatory response syndrome. In systemic inflammatory response syndrome, here two response, one local response, another one systemic response. In local response, what happened? Edema, necrosis and hemorrhage due to inflammations of pancreas. This is local response, edema, necrosis and hemorrhage. And another one response is increase vascular permeability. This is the blood vessels. Here vascular permeability is not present, intact blood vessels, but due to presence of cytokinin, interleukin 1, interleukin 6 and TNF alpha, these cytokinins makes the blood vessels permeable. And when the blood vessels increase permeability of the blood vessels, what happened? Fluid out to the interstitial spaces from the vascular spaces. From the intervascular spaces, fluid out to the interstitial spaces. This is called third spacing. Understood? When the pancreas get inflamed, it stimulate our immune system. Neutrophil, macrophage come here. Macrophage release interleukin 1, interleukin 6 and TNF alpha, which are cytokinin. In the presence of cytokinin in our blood vessels, what happens? Systemic inflammatory response syndrome. Here two response happen, one local response, one systemic response. In local response, edema, necrosis and hemorrhage due to the presence of cytokinin, and in systemic response, what happened? Vascular permeability increase. This is the normal blood vessels and this is the increased vascular permeability. When the vascular permeability is increased, fluid shift from intervascular space to the interstitial space. This is called third spacing. When fluid come out from the blood vessels, what happened? Blood volume decreased in the blood vessels, so hypovolemia. Low volume in circulatory systems. This hypovolemia affect our organ also. First, heart. Cardiovascular system depends on blood volume. If low blood volume is present, hypovolemia is present, third spacing is present, then what happen? Blood pressure will be decreased. When blood pressure decreased, then blood not perfuse the organ properly. When blood pressure decreased, then perfusion of organ is decreased, and then what happened? Shock will be happened. When shock is present, what happened? When shock is present, when the organ not get the proper blood, adequate perfusion due to hypovolemia, so pancreas get necrosed, and after necrosis it becomes dry. First ischemic, then necrosis, then infarction, and it becomes dry. Same incident happened in kidney. Due to decreased renal perfusion, for what? Due to hypovolemia. If hypovolemia is present, means low volume of blood in the circulatory system, not perfusing the organ properly. Due to the low blood volume, renal perfusion also decreased. Due to decrease of renal perfusion, acute kidney injury happened here and increased burn. Same incident happened in lungs, through alveoli and the blood vessels. Here alveoli, gaseous exchange occur in capillary and alveoli. If vascular permeability increase here, then what happen? Blood goes from the capillary into the alveoli. Here fluid goes to the alveoli. What happened? Alveoli filled with fluid due to what reasons? Increased vascular permeability. So alveoli filled with fluid accumulate in the alveoli. What happened if fluid accumulate in the alveoli? Alveolar edema. When alveolar edema is present, then what happened? Gaseous exchange not happened here. So last of all, ARDS develop, acute respiratory distress syndrome. When ARDS is present here, what happened? Oxygen is decreased. When oxygen is decreased, then body tries to breathe fast. Then what happened? Respiratory distress will be present, and also collapse of lung. This is called atelectasis. Same problem happened here. When the inflammation, pancreas inflammation is present, it stimulates tissue factor. What happens if tissue factor is stimulated? It causes clotting. All over diffuse clotting here, diffuse clotting present here. What if clotting is present? Clotting, how clot develops? More platelet, more RBC accumulate here for clotting. If platelet is come here for clotting, then what happen? In body, thrombocytopenia and anemia will be present due to decrease of platelet and RBC, due to consumption of platelet and RBC. No clotting protein is present here, so PT-INR will be decreased. Clotting time will be increased. Now, if what happened here? If pancreatitis is present, then inflammation is present. Inflammation stimulates tissue factor. Tissue factor causes clotting. For clotting purpose, what required? Platelets and RBC. If platelets and RBC accumulate here for clotting purpose, then what happen? In body, thrombocytopenia and anemia will be present. If more platelets and more RBC is present here, then clotting time will be decreased because there is no platelet present in the body for clotting. So PT-INR will be increased. PT-INR will be increased here, and lots of degradation product will be present, so D-dimer will be increased, and last of all, risk of bleeding will be increased. High risk of bleeding because of platelet not present adequate here. All the platelet are consumed here. Consumptions of platelet for making clots. So due to inadequate platelet in the body, high risk of bleeding, chances of bleeding is increased. So overall this is called disseminated intravascular coagulation, DIC. So what will I get here? First, hypovolemia. Due to why hypovolemia happened here? Due to third spacing. Why third spacing available here? Because of increased permeability of blood vessels, so fluid comes out from the blood intravascular space to interstitial space. Why permeability increased? Due to presence of cytokinin. Why cytokinin release? Due to the activations of macrophage. Why macrophage activate? Because it stimulates the immune system. Who stimulate our immune system? Pancreatitis. So all the complications arise for the pancreatitis. This is the systemic complications. Then comes to the local complications, which I described previously about pseudocyst. How the pseudocyst looks like? This is the picture of pseudocyst. This is the picture of pseudocyst. Pseudocyst is a local complications, and also it develops from the pancreas is protease lipase causes the autodigestion of pancreas and breaking down the fat tissue, and it leads to a liquefactive necrosis. This picture, first this picture shows that one is autodigestion and hypovolemia. Autodigestion, what is autodigestion? Protease and lipase causes autodigestion of pancreas, and hypovolemia due to the increased permeability, the fluid shifting from intravascular spaces to the interstitial spaces, which is third spacing. That's why the low circulatory volume in the blood vessels. So this is hypovolemia. Autodigestion plus hypovolemia causes pancreatic ischemia, because if pancreas not get the blood supply properly, then what happen? Ischemia. Then ischemia first, then after that is got infarcted, and this is called infective necrosis. And another one is due to the increased permeability. This is the normal picture, normal pancreas and normal blood vessels. In the presence of cytokinins, the permeability increase. If the permeability increase, then from the blood vessels fluid shifted to the pancreas. From the blood vessels fluid out and shifted to the pancreas. If fluid collect in the pancreas, then what happen? Inflammation of the pancreas, and this fluid, when capsulated with the fibrous capsule, then it called pseudocyst. When the fluid accumulate in the pancreas, it leads to inflammation, and if this fluid are capsulated by a fibrous tissue, then it is called pseudocyst. When in the pseudocyst bacterial infection occur, then it turns to the pancreatic abscess. This pancreatic abscess is severe complications and it leads to pain and fever and leukocytosis. So this is a local complication, pseudosis, due to the presence of autodigestions and hypovolemia. Our pancreas not perfused properly, blood supply is decreased, so infections, first ischemia, then infections, our pancreatic tissue get die. So this is called infective necrosis. Infective necrosis and also the increased permeability of blood vessels. Due to the presence of increased permeability of blood vessels, fluid accumulate in the pancreas and fluid filled in the pancreatic tissue. This leads to inflammations, and when the fluid filled area are capsulated with fibrous tissue, this is called pseudocyst. When the pseudocysts are in the pseudocyst bacterial infection happen, then this bacterial encapsulated pseudocyst is called pancreatic abscess, and this pancreatic abscess leads to pain and fever. This is the picture of pseudocyst. And this is the picture of pancreatic abscess, which is severe complications. Pleural effusions, if the fluid comes out due to presence of vascular permeability, which is due to the cytokinin effect, or capillaries, from the capillaries fluid shifted to the lungs. So if the fluid accumulate in the pleural space, the pleural effusion. If the our alveoli get collapsed or lungs get collapsed, then atelectasis, pneumonia. If infections occur in the lungs, acute respiratory distress syndrome. If the alveoli is filled with fluid, then no gaseous exchange occurred here, oxygen becomes decreased, and the patients may develop acute respiratory distress syndrome due to increased permeability. The blood vessels, from the blood vessels fluid shifted to the third space, interstitial space, so intravascular blood volume will be decreased. So then hypotension and last of all shock and the tetany are the severe complications of pancreatitis. These are all complications of pancreatitis. Now we'll discuss about the medical management of pancreatitis.